3 weeks ago, I announced more openings of Texas businesses. For regions where COVID hospitalizations were less than 15% of all hospitalizations, many businesses were able to expand to a 75% capacity. That included all retail stores, restaurants, office buildings, manufacturing facilities, museums, libraries, gyms, and so much more. But even then, some businesses remained at a 50% capacity, and bars still were not allowed to open. I explained then that the spread of COVID had been cut by more than half since July. But I also noted that we needed to see the COVID spread continue to be contained before additional openings could be made safely. The good news is that even with additional business openings, even with more students returning to school and more gatherings like football games, Texans have shown that we can contain the spread of COVID. For example, today the 7-day average for the positivity rate, for the number of new COVID cases, for hospitalizations and fatalities have remained steady since I made my last announcement. So, it is time to open up more, provided that safe protocols continue to be followed. First, with few exceptions, all businesses that are at a 50% capacity can now expand to a 75% capacity. That includes businesses like amusement parks and bowling alleys, bingo halls and fine arts performing halls, movie theaters, water parks, zoos, aquariums, and many other businesses. Until now, only 2 types of businesses have not been open since July. One is river tubing operations, and the other is bars. It is time to open them up. Initially, they can open at a 50% capacity, provided that they follow the safety protocols. If we continue to contain COVID, then these openings, just like other businesses, should be able to expand in the near future. The primary safety protocol for tubing operations involves the way that they transport customers. Bars must follow distance and seating protocols, just like restaurants have used, as well as other protocols that are intended to contain the spread of COVID. The effective date for all of these expansions is a week from today, which is October the 14th. And like before, to ensure that hospital capacity for COVID patients is maintained, these expansions apply only in the hospital regions where COVID hospitalizations are less than 15% of hospital capacity. To ensure that these businesses open safely and to help enforce the health protocols, these openings will be done in conjunction with county officials. County judges will be able to opt their county into these new openings beginning October the 14th, provided that they assist in enforcing the safe protocols. Now, there are 3 reasons why these business expansions, especially the opening of bars, should be more successful than they were last time. First, everyone is much more informed about how fast COVID can spread, how it can overwhelm hospitals if not contained, and what must be done to contain the spread. Second, protocols in place this time are better than used previously, and that is due in part to the helpful input received from bar owners and associations. Third, we are far better prepared to test and to treat Texans for COVID than any time before now. We are now averaging more than 65,000 COVID tests per day. And beginning next week, we will add an additional 100,000 rapid result tests each day. These tests will help us to be able to quickly learn about any COVID outbreaks in schools or nursing homes or in any vulnerable setting. We will be able to more quickly test Texans and treat Texans who get COVID. Also, the treatments are getting better. Hospitals now have abundant supplies of medicines like remdesivir and dexamethasone. And even more powerful medicines will soon be added that will help COVID patients recover even faster. For months now, the spread of COVID-19 has been contained in Texas. Doctors have said that the biggest reason for that success is because Texans are taking COVID seriously. People are following CDC standards like social distancing, sanitizing their hands, and wearing face coverings when around others. So opening bars does not mean that COVID is no longer a threat. Most Texans are still susceptible to it. We simply now know better how to protect ourselves from getting COVID. Everyone has the individual ability to avoid getting COVID and to avoid spreading COVID simply by following the safe practices that everyone has already learned. If everyone continues the safe practices, Texas will continue to contain COVID, and we will be able to open 100%.